Picture this. It's 3 a.m. and once again you're up, shuffling to the bathroom. You've already gone twice tonight, and it's only the middle of the night. By morning, you feel drained, not just from lack of sleep, but from the frustration that your body just won't cooperate anymore. For millions of men over 60, this is more than an inconvenience. It's a daily battle with an enlarged prostate, what doctors call benign prostatic hyperplasia, or BPH. It doesn't just affect your bladder. It steals your rest, your confidence, and even your intimacy. And here's the reality. Medications often stop working, or they come with side effects you just can't tolerate. Dizziness, fatigue, or even sexual problems. At that point, you're left facing the bigger question: what's next? That's when doctors often bring up procedures with unfamiliar names: UroLift, Rezūm, and TURP. Each promises relief, but each comes with trade-offs. So how do you know which is right for you? And how can you make that choice confidently without feeling overwhelmed by medical jargon? Welcome to Men's Vital Health Wellness Wisdom. I'm Dr. Emily Carter, and on this channel, we tackle the real questions men face after 50, from prostate health to circulation, vitality, and intimacy. No topic is too sensitive to explore. Today, I'll guide you through these 3 procedures step by step, so you can walk into your doctor's office prepared, informed, and ready to ask the right questions. Because here's what's at stake. Ignoring an enlarged prostate doesn't make it go away. Over time, it can cause bladder damage, kidney strain, urinary retention, and repeated infections. And yet, making the wrong treatment choice can lead to side effects you might regret, from retrograde ejaculation to long recovery periods. This video isn't about selling you one procedure over another. It's about giving you the roadmap so you and your doctor can decide what truly fits your health, your lifestyle, and your goals for the years ahead. Stick with me until the end, because I'll also share the 3 essential questions you must ask before agreeing to any procedure. These questions can save you from unnecessary risks and help ensure you're making the choice that's right for you, not just what's easiest for the clinic. Let's start with the basics. The prostate is a small, walnut-sized gland that sits just below the bladder. Its main job? Producing fluid that nourishes and protects sperm. But as men age, that walnut often grows into something closer to a plum. And because the urethra, the tube that carries urine, runs right through the center, the growing prostate squeezes it like a clamp. That's why your stream gets weaker, you feel like you never quite empty your bladder, and why nights are spent waking up again and again. Some men barely notice it. Others can't get through the day without planning bathroom stops everywhere they go. Either way, it's not just aging. It's a medical condition that deserves treatment. Now, medications are often the first line of defense. They can relax the prostate muscles or shrink the gland. But for many men, these drugs eventually stop working, or the side effects, like dizziness or reduced sexual function, become unbearable. That's when your doctor may bring up procedures. And this is where the confusion often starts. Words like UroLift, Rezūm, and TURP may sound like random acronyms, but they each represent a very different path to the same goal: better urine flow and better quality of life. So, which one should you choose? To answer that, let's take them one at a time, starting with the least invasive option, UroLift. And as we go, I'll explain not just how each works, but what type of man tends to do best with it. Act 2. UroLift explained. Let's begin with UroLift. Among the 3 procedures we're covering today, UroLift is often considered the least invasive. Think of it as a mechanical solution to a plumbing problem, without cutting, burning, or removing prostate tissue. Here's how it works. During the UroLift procedure, tiny permanent implants are placed inside the prostate. These implants act like curtain tiebacks, gently pulling the enlarged tissue away from the urethra so urine can flow more freely.
The procedure is usually done under local anesthesia, sometimes even in a doctor's office. And the whole thing can take less than an hour. Because there's no cutting or heating, many men find the recovery faster than with other treatments. The appeal of UroLift comes down to 3 big advantages. 1. Quick recovery. Most men are back to normal activities within a few days. 2. Minimal side effects. Unlike some procedures, UroLift does not typically cause sexual side effects like retrograde ejaculation. 3. Office-based. Because it's less invasive, it can be done outside of a hospital, which means less stress, less cost, and less time away from home. In fact, studies show that UroLift provides significant symptom relief within just 2 weeks, and for many men, that relief lasts at least 5 years or longer. But UroLift isn't for everyone. It tends to work best for men with mild to moderate enlargement of the prostate, not extremely large glands. No severe complications like bladder stones or recurrent urinary retention. Men who place a high value on preserving sexual function. If your prostate is extremely large, say over 80 grams, or if you already have severe urinary retention, your doctor may recommend another option. Take John, a 67-year-old retired teacher. He was waking up 4 to 5 times a night and had tried 2 different medications, both of which left him dizzy and tired. His biggest concern wasn't just urination, it was intimacy. He didn't want a solution that would rob him of his sexual function. After discussing with his doctor, John chose UroLift. He had the procedure done on a Friday, rested over the weekend, and by Monday, he was already noticing a stronger urine stream. More importantly, he kept the intimacy with his wife intact. For him, that was priceless. Of course, no procedure is perfect. With UroLift, some men experience temporary side effects, like burning during urination, urgency, or mild blood in the urine. These usually resolve within a week or 2. And while the implants are designed to stay in permanently, in rare cases, they can shift or cause discomfort. Another limitation is that symptom relief, while significant, may not be as dramatic as with more aggressive procedures like TURP. So if your symptoms are very severe, or if your prostate is very large, UroLift may not provide the level of relief you're hoping for. Longevity is another question men ask. Research shows UroLift can provide lasting relief for 5 to 7 years in many cases. But yes, some men eventually need a repeat procedure or move on to something like TURP down the road. That doesn't mean UroLift failed. It simply means it bought time with less invasiveness, and sometimes that's exactly what a man needs at a certain stage of life. So, to summarize, UroLift is best for men who want a quick, minimally invasive option that preserves sexual function and gets them back on their feet quickly. It may not be the forever solution, but it can dramatically improve quality of life without the downsides of more invasive surgery. But what if you're looking for a treatment that goes a little deeper? One that doesn't use implants, but instead harnesses the body's own healing power to shrink prostate tissue from within. That brings us to our second option, Rezūm.
Act 3. Rezūm Therapy Steam Power against BPH. Now, if UroLift is like gently pulling back a curtain, Rezūm is more like using nature's own power steam to shrink the prostate from the inside out. It may sound unusual, but the science is both fascinating and surprisingly effective. Here's the idea. Water is heated into steam. That steam is then carefully injected into the prostate tissue through a tiny needle. When the steam turns back into water, it releases energy enough to gently destroy the extra prostate cells that are blocking your urethra. Over the following weeks, your body naturally reabsorbs this treated tissue. The result? More space around the urethra, a stronger urine flow, and fewer nighttime trips to the bathroom. Rezūm offers a powerful middle ground between medications and surgery. Its main attractions are: 1. Minimally invasive. Like UroLift, it's often done in an outpatient clinic, usually under local anesthesia. 2. Durable results. Studies show symptom improvement lasting up to 5 years or more. 3. Preserves sexual function for many. Compared to TURP, Rezūm tends to have fewer long-term sexual side effects. And unlike UroLift, Rezūm doesn't leave behind implants. Everything works with your body's own healing process. Rezūm works best for men with mild to moderately enlarged prostates, generally in the 30 to 80 gram range. It can also help men who want a more durable solution than UroLift, but without the invasiveness of TURP. It's also suitable for men who may not be ideal surgical candidates due to age or other health concerns, since the procedure is shorter and requires less anesthesia. Take Robert, age 72. After years of relying on medication, he was still waking up 4 times a night. He didn't want implants and was nervous about surgery. His doctor recommended Rezūm. The first week was tough. He experienced some burning and had to use a catheter briefly. But by the 6th week mark, Robert was sleeping through the night with a strong, steady stream. He said the trade-off of short-term discomfort for long-term relief was worth every bit. Like any procedure, Rezūm has its downsides. The most common are burning or discomfort during urination in the first few weeks, temporary urinary retention requiring a catheter for several days, some urgency or frequency before the healing settles. And while sexual side effects are less common than with TURP, a small percentage of men do report retrograde ejaculation or erectile changes. It's not risk-free, but compared to traditional surgery, the odds of preserving sexual health are better. One key thing to remember about Rezūm is that it's not instant. Unlike UroLift, where men often feel better within days, Rezūm takes patience. Symptom improvement builds over weeks, sometimes 2 to 3 months. So, if you're looking for quick relief, Rezūm may test your patience. But if you can wait, the long-term payoff is often very satisfying. Clinical trials show Rezūm's results holding strong for at least 5 years in most men. Some may need retreatment, but for many, it offers a durable balance of safety, effectiveness, and preserved quality of life. So, in summary, Rezūm is ideal for men who want a minimally invasive procedure with durable results, who can tolerate a few weeks of discomfort and are willing to wait for gradual improvement. It may not provide the immediate results of UroLift or the powerful relief of TURP, but for many men, it's the sweet spot in between.
Act 4. TURP, the gold standard. For decades, when medications failed, there was really only one clear option: TURP, or transurethral resection of the prostate. Doctors often call it the gold standard because it's been performed for more than 50 years with strong and reliable results. But gold standards also come with trade-offs. Here's how TURP works. Using a tool called a resectoscope, the surgeon goes in through the urethra, no external incisions. Then, with an electric loop, they carefully shave away excess prostate tissue that's blocking the urethra. Think of it like clearing a blocked drain. Instead of pulling tissue aside like UroLift or shrinking it slowly like Rezūm, TURP actually removes it. That's why results are often immediate and dramatic. The biggest advantage of TURP is its effectiveness. For men with severe symptoms or very large prostates, nothing else comes close. Urine flow improves quickly, urgency decreases, and nighttime trips to the bathroom drop dramatically. Studies show TURP provides durable relief that can last 10 years or more, making it one of the most effective long-term solutions available. TURP is often recommended for men with very large prostates, men with severe symptoms that haven't responded to medication, Men experiencing serious complications like repeated urinary retention or bladder damage. If you've reached the point where bathroom trips dominate your life and quality of life is slipping away, TURP is often the procedure doctors turn to. Consider Michael, 68, a retired mechanic. He had struggled with BPH for over a decade. By the time he saw his urologist, his bladder was retaining so much urine it was putting him at risk for kidney problems. Michael underwent TURP at his local hospital. The first few weeks were tough: catheter, hospital stay, and some discomfort. But within a month, he said it felt like a new lease on life. His urine stream was strong, he could sleep through the night, and he no longer worried about accidents when out with his family. Now, TURP's strength is also its drawback. Because it's more invasive, it comes with more risks. These include retrograde ejaculation. Semen goes backward into the bladder instead of out during orgasm. This is not dangerous, but it can affect fertility and intimacy. It happens in up to 65 to 75% of men after TURP. Bleeding. Some men require a blood transfusion, though advances in technique have lowered this risk. Hospital stay. Unlike UroLift or Rezūm, which are outpatient, TURP usually means a few days in the hospital. Recovery time. You may need a catheter for a few days, and full healing can take weeks. And while rare, serious complications like infection, incontinence, or erectile difficulties can occur. Recovery after TURP is slower compared to the minimally invasive options. Most men need about 4 to 6 weeks before they feel fully back to normal. During that time, avoiding heavy lifting, strenuous activity, and even sexual activity is important to allow the body to heal. The payoff is durability. Many men enjoy a decade or more of symptom relief after TURP. While a small percentage may eventually need retreatment, it's far less common than with UroLift or Rezūm. So to summarize, TURP remains the gold standard, delivering the most powerful and lasting relief, especially for severe cases. But it requires a hospital stay, carries a longer recovery, and comes with a higher chance of sexual side effects. For many men, the benefits far outweigh the risks. For others, the invasiveness is simply too much. So now that we've walked through each option individually, the real question is, how do they stack up against each other? Coming up next, I'll compare UroLift, Rezūm, and TURP side by side so you can clearly see which path might fit your health, your lifestyle, and your personal priorities.
Act 5. Side-by-side comparison. Now that you know what each procedure does, let's put them head-to-head. Because when you're the one making the decision, it's not just about the science, it's about what fits your body, your age, and your goals for the years ahead. First, let's talk about effectiveness. UroLift usually gives solid relief for mild to moderate symptoms. It doesn't remove tissue, so improvements may be a bit less dramatic. Rezūm often delivers stronger relief than UroLift, though it takes patience. Symptoms improve gradually over weeks. TURP? It's the heavy hitter. For severe symptoms or very large prostates, it provides the most dramatic and longest-lasting relief. Next, recovery. UroLift shines here. Many men are back to daily activities in just a few days. Rezūm takes more patience. You may deal with burning, urgency, or a catheter for a week or two, and improvements don't peak until month 2 or 3. TURP requires the most downtime, usually several weeks before you feel fully normal again. For many men, intimacy is a major concern. UroLift has the lowest risk of sexual side effects. Ejaculation and erections are usually preserved. Rezūm also tends to preserve sexual function, though a small percentage of men experience changes. TURP, however, carries the highest risk. Retrograde ejaculation happens in the majority of cases, and while it's not dangerous, it can affect intimacy and satisfaction. What about durability? UroLift typically provides relief for 5 to 7 years before some men need retreatment. Rezūm holds strong for a similar time frame, sometimes longer, depending on prostate size. TURP is the longest lasting, often giving a decade or more of freedom from symptoms.
Risks follow a spectrum. UroLift, mild burning, urgency, or bleeding for a short time. Rare implant issues. Rezūm, temporary discomfort, catheter use, occasional retrograde ejaculation. TURP, bleeding, infection, hospital stay, and higher risk of permanent sexual side effects. The trade-off is simple. The stronger the result, the higher the risk. So which option fits which kind of man? UroLift is for the man who wants quick relief, values intimacy, and has a smaller to moderate prostate. He's active, wants minimal downtime, and is comfortable if retreatment might be needed years later. Rezūm is for the patient willing to wait, someone who wants longer durability than UroLift, but still wants to avoid major surgery. It's for men who don't mind short-term discomfort for mid-term gains. TURP is for the man whose symptoms are severe, whose prostate is large, or whose bladder is at risk. He's ready for hospital care and wants the strongest, longest-lasting solution available. When you lay it out side by side, the differences become clear. UroLift is the fastest recovery, Rezūm is the patient man's choice, TURP is the strongest but demands the most in return. No single option is perfect, it all comes down to your priorities. So, here's the bottom line. If you want speed and safety, UroLift may be best. If you want durability without implants, Rezūm might be your answer. If you want power and permanence, TURP is still the champion. The choice isn't about which procedure is best overall, it's about which one is best for you. Of course, even with all this information, most men still feel unsure. So how do you actually make the decision with your doctor? That's what we'll tackle in the next section, a simple decision framework you can use to guide the conversation.
Act 6. How to decide with your doctor. Now you know the strengths and trade-offs of UroLift, Rezūm and TURP. But here's the reality. Charts and diagrams can only take you so far. The real decision happens in your doctor's office, face to face, when you ask the right questions and weigh the answers against your own priorities. Clarify your personal priorities. Every man is different. Some say, "Doctor, I just want to sleep through the night." Others say, "I don't care if recovery takes longer, I just want the strongest solution." Before you walk into that appointment, write down your top 3 goals. Is it preserving intimacy? Is it minimizing downtime? Is it avoiding repeat procedures? These priorities will guide the conversation, and they'll help your doctor understand you, not just your prostate. Ask about eligibility and prostate size. Not every man is eligible for every procedure. UroLift works best if your prostate is moderate in size and doesn't have a median lobe blocking the urethra. Rezūm can treat a wider range but still has limits. TURP can tackle even large prostates but with more risks. Ask your doctor, based on my prostate size and shape, which options realistically fit me? This single question can eliminate options that aren't even on the table. Understand the recovery timeline. Ask your doctor, how long will I need to rest and what limitations will I face? If you're caring for a spouse, still working, or planning a trip, recovery time matters. For some men, the promise of faster relief with TURP is worth the downtime. For others, a short UroLift recovery is the better fit, even if relief isn't as dramatic. Talk honestly about sexual function. Too often men are embarrassed to bring this up, but intimacy matters even in your 70s or 80s. Ask directly, what are the chances I'll experience retrograde ejaculation or changes in erections? UroLift has the lowest risk. Rezūm is fairly safe. TURP carries the highest chance of change. Your doctor should be honest with you, and you deserve that honesty. Ask about durability and retreatment. Think long-term. Ask, how many years can I expect relief before needing another procedure? If you're 65, you may want the option that buys you 10+ years of relief. If you're 80 and simply want to improve your comfort for the next few years, durability may matter less than recovery speed. Weigh the risks versus rewards. Every procedure carries trade-offs. That's medicine. Ask your doctor, what complications do you see most often in your patients with this procedure? This gives you real-world perspective, not just textbook risks. Consider your lifestyle and support system. Are you still working? Do you travel? Do you have a spouse who depends on you? These questions matter. If you can't afford weeks of downtime, UroLift may be better. If you're patient and want a middle ground, Rezūm makes sense. If you need maximum relief because your quality of life is suffering, TURP may be worth the recovery. Don't rush the decision. The worst decision is a rushed one. Unless your health is in immediate danger, take your time. Bring your spouse or adult child to the consultation. A second set of ears often catches details you may miss. The decision checklist. So, here's your simple decision checklist. 1. Write down your top 3 priorities. 2. Confirm which procedures you're eligible for. 3. Ask about recovery, intimacy, and long-term durability. 4. Weigh risks honestly. 5. Consider your lifestyle and support system. 6. Take your time and involve loved ones. When you go through these steps, the choice often becomes clear. The truth is, the best procedure isn't just about medical facts. It's about your goals, your values, and your vision for the years ahead. When you walk into your doctor's office with clarity and confidence, you don't just choose a procedure. You choose the future you want to live. In our final section, I leave you with a closing message of encouragement, because no matter what you choose, you do have options, and a brighter, healthier chapter is still ahead.
We've covered a lot today, from UroLift to Rezūm to TURP. And if your head is spinning a little, that's perfectly normal. These are big decisions. But here's what I want you to remember. You are not powerless. You have choices, you have knowledge, and you have doctors who can guide you. And now, you also have the tools to guide them in the right direction for your life. For many men over 60, urinary symptoms and prostate issues can feel like a silent thief, stealing your rest, your intimacy, and your confidence. But the truth is, this chapter doesn't have to be about decline. It can be about taking back control, making smart decisions, and enjoying the vitality you've worked so hard for. Don't ignore the problem. Don't assume it's just part of getting older. And don't settle for living in discomfort when safe, effective options are available. Whether your choice is UroLift, Rezūm, or TURP, what matters most is that you make the choice instead of letting the condition make it for you. You deserve restful sleep. You deserve confidence in your body. You deserve to live these years with freedom, dignity, and energy. Remember, age doesn't take away your right to health. It makes it even more precious. If you found this video helpful, please take a moment to like, share, and subscribe to Men's Vital Health, Wellness Wisdom. This is where we talk about the issues most men over 60 face but rarely discuss, and where we find real, practical solutions together. And if you've already had one of these procedures, or if you're considering it, share your story in the comments below. Your experience could be the encouragement another man needs to take that next step. No matter what choice you make, remember this: your future can still be strong, fulfilling, and vibrant. Prostate health is just one part of your story, and the best chapters, they're still waiting to be written.